this is just the beginning.
Hello, and welcome to our second virtual News Shapers event of 2021. I'm Sarah Kehaulani-Gu, Executive Editor at Axios. I'm joining you here from our headquarters in Arlington, Virginia. And I want to thank, first of all, our sponsor, Bank of America, for making this event possible. I want to welcome our audience who is joining us on many different platforms today, live streaming. We are live on Facebook, on Twitter, on LinkedIn, and Axios.com. Thank you so much for joining us on your busy day from wherever you are. Today, we have an exciting conversation for you over the next 30 minutes. I'm going to be joined by my colleague, Allison Snyder, in light of International Women's Day and Women's History Month. We are going to have some conversations with two incredible women leaders who are taking on enormous challenges and helping to support women who are facing gender and racial divides as part of this pandemic. I'm excited and thrilled to welcome our first guest for this conversation. It's San Francisco Mayor London Breed. Welcome, Mayor.
Thank you, Sarah.
It's great to have you. Thank you for joining us from City Hall in San Francisco. I want to start with a big picture question. A year ago, women were nearing a milestone. We were nearing parity in terms of our representation in the workforce. And with the pandemic, a lot of that progress has been lost. And millions of women have dropped out of the workforce altogether. That's true here where I am in Washington, D.C. That's true in San Francisco. So I wanted to ask you, as we're nearing the end of this, as we're coming out of the pandemic, what do you see are ways that can best help women to regain their footing and regain their momentum?
Well, I think more important than ever, we need to really focus, of course, on our economy and getting our schools open and getting children back into the classroom and back into daycare. We know that oftentimes the responsibility to take care of the family falls on women more so than anyone else. And as a result of that, with the challenges of of distance learning, the challenges that exist around trying to balance workplace, trying to take care of family members, it has definitely disproportionately impacted women more than anything else. As we began our process of reopening, making sure that we are being aggressive in our recruitment and retention of not only women in our workforce, but even here in San Francisco, our boards, our commissions, our elected leadership needs to be representative of women in this city. And that is something that I've been really proud that we've done here. The COVID response has centered around mostly women, including our director of the Department of Emergency Management, our director of the fire department. We have a lot of amazing women who are leading San Francisco through this pandemic, and our Department of Public Health. So we're going to have to be really aggressive and strategic about the recruitment and retention of women as we begin to reopen based on the challenges that we have faced during COVID.
You make some really excellent points, Sarah, about kids going back to school. I understand San Francisco public schools are beginning to reopen next month, at least that is the plan, and many other cities that's the case. And you have such a compelling personal story. You grew up in San Francisco, and like you mentioned, you have your own personal experience you bring to this role and a lot of women leaders around you. I'm wondering, what have you drawn from your experience and from those who are leading with you? What have you put into place based on that experience about what working women, working families need to get back on their feet? Could you talk about some specific changes that you've made over the past year?
Well, I'm really proud that from day one, because we knew that this pandemic would disproportionately impact lower income communities in San Francisco, which primarily are led by women, that it was necessary for us to embed in our entire response of COVID equity and really focusing on making sure that we looked at alternatives to school and to childcare, because again, we knew women would be mostly impacted. We set up learning hubs so that when the schools did shut down and there were a lot of working parents that needed to get to work. We made sure that we had learning hubs so that parents and mostly women could continue to work while their child was being cared for. We set up other resources of testing and also those who were positive from COVID. We provided payments to those who didn't qualify for other payments or sick leave from their jobs. We work with small businesses, a lot of the hair shops, mostly run and owned by women, to provide no interest loans and grants. And the other challenge that we knew would persist, especially with more people being at home, unfortunately, domestic violence was a big challenge during this pandemic, and the need for mostly women to have safe places to go and to get support and to leave the home in the midst of a pandemic. We had to make sure that there were resources readily available for that as well. So a number of things that we put into place, and it's been tough in general, but we're getting through this, and I'm really proud of the work that we've done here in San Francisco.
That's great to hear. And let's talk a little bit about equity and about health equity in particular. We know that the pandemic has, made clear to a much broader audience the disparities in health outcomes that people see, and in terms of who's getting COVID, who's dying from COVID at disproportionate numbers. And now we have kind of a different challenge, right? We have the vaccine rollout and making sure that people get it. There's some resistance in some communities to get it. So I'm wondering, can you tell us about how that's playing out in your city? How do you ensure that there's equity?
Well, I am so proud of what we've done here in San Francisco, because I grew up, as you talked about, in a community where they did not always receive access to resources. And I know my community like the back of my hand, because when we talk about equity, we got to go and meet people where they are. And it can't be about a system where they have to go online, especially when we're talking about people who are 65 and older. They just know, like, for example, in the Western Addition, there's a place called Maxine Hall. If you need some help, you need some support, you have a medical issue or a question, there are people in our community who don't go to hospitals and don't feel comfortable with that. And they also have concerns about the virus. Well, if Maxine Hall is providing that virus and you don't have to make an appointment, you just have to live in the local zip code, the likelihood that we're going to get more people vaccinated faster who are the most vulnerable population in communities that typically are not served equally, it's going to be important to do that. And this is how we make that happen. So I'm really proud that we've done this throughout the city in the places where we've seen people with the highest number of cases. In the Mission District, where a large Latino population, sadly, they were disproportionately impacted by this virus. And so it was important to set up a location there in the Mission at General Hospital, where it's a drop-in based on your zip code, in the places where we have the highest number of cases, in the communities disproportionately impacted in the Bayview, in Chinatown, in the Western Addition. No appointment necessary. You just have to meet the qualifications of being 65 and older, healthcare worker, and now educators, muni drivers, and others that we've added to that list. Those guidelines are based on the state, but we had to make it easy for people to get vaccinated. And I am so proud of what San Francisco has done in that regard.
Really interesting. I wanted to ask you about another initiative you have announced for the city. At Axios, we're really interested in covering what lasting impacts the coronavirus has had on our society, on the way we work, and on healthcare. And it's clear that some things are here to stay. One part of your initiative, the Dream Keeper initiative, redirects some funds from police, or proposes to, into other parts of the community. And one thing I wanted to highlight was, I believe it includes guaranteed income, and a guaranteed income program, which would help support families at the lowest rungs who really need it. It's really interesting. There's a lot of conversation about this in the stimulus bill in Congress in terms of a child tax credit. I wanted to know, how do you think that's going to help address some of the inequity? And what do you say to critics, particularly on the right, who feel like this is another welfare program?
Well, again, it goes back to my upbringing, and there were limited opportunities. I grew up in public housing, limited opportunities, limited job access to job opportunities. And when you look at what's happening in a place like San Francisco, in particular with the African American community, they represent less than 6% of the population here. Yet, when you look at unemployment numbers, you look at homeless numbers, you look at high school dropouts, criminally justice involved, it's a larger percentage. In fact, almost 50% of the homeless population in San Francisco is African American. And so there's something wrong where a particular community is constantly struggling when there is so much wealth in San Francisco. And I grew up with a lot of these people. A lot of promises have been made. This is not really about a handout. It's about access to an opportunity. Our goal is to make sure this community is supported and uplifted, and we can transition people into job opportunities and other resources that are available. But just imagine going home and not having $1 in your pocket to even buy lunch, and looking for a job after maybe you've come home from jail and you don't know what else to do. And that leads to challenges with crime and other things that exist in our city. And so what we're trying to do is we're trying to ensure the success of this community, because there have been things that have been done in this city and in this country that have made it difficult for some African Americans to succeed. And rather than expressing disappointment and frustration and criticism, let's see if changes that are different than what we've ever done could actually work and turn people's lives around so that they too can thrive in a city like San Francisco.
Well, thank you so much, Mayor Breed, for sharing your report on what you're doing on the West Coast. We really appreciate your time.
Thank you, Sarah.
And next up, we'll share a short video from our sponsor, Bank of America.
Every country wants to grow its economy, wants to create jobs, wants to ensure shared prosperity for its people. And women entrepreneurs are extraordinary engines that contribute to economic growth.
No country, no community, no corporation can afford to leave women behind and think they're going to be able to compete in a global marketplace.
Research after research shows that if you invest $1 development dollar in a woman, 90 cents of that she will spend on her family, on her community, anything other than herself.
Women are 50% of the world's population, and they deserve to have the tools and access to expertise to get them to a place where they are really fulfilling their potential.
Women are our best investment, and I think they think differently. They're also looking at business differently. They're starting different kinds of business, and they're just incredible entrepreneurs. I see the tenacity, I see their businesses, and I see the potential for growth.
You have more women on boards. You have more women in senior management. They are speaking up, speaking loudly, making decisions. And when all that happens, a lot of things change.
Hi, I'm Allison Snyder, a managing editor at Axios. Our final guest today is activist, writer, and host of the Undistracted podcast, Brittany Packnett Cunningham, who's joining us from Washington, D.C. as well. Thank you so much for being here, Brittany.
Thanks for having me.
I wanted to talk a little bit with you about jobs first. And the pandemic has really exposed and is exacerbating inequities in the U.S. And the toll of COVID-19 has been especially devastating for women of color. There was the latest jobs report last week, which was the latest piece of evidence. Here are data here, in which unemployment rose among Black women in February from 8.5% in January to 8.9% last month. And this was the only group of women that lost workers. What's driving this, and how can Black women be brought back into jobs?
So it's critical that we have a well-rounded conversation about this. What this means is that there are families who are going to go without bills paid, without food on the table. What this means is a deep psychological effect, because racial battle fatigue is real, especially in a pandemic. What this also means is that there is physical effect. What we've seen in the Black community is that we've actually lost 2.7 years of life expectancy due to COVID. When you add that to the fact that some studies show that Black women are 7.5 years older biologically than white women because of all of the things that we endure, what we're talking about is a catastrophic effect on communities. Just like any other community, what happens to the women happens to everyone, and Black people are no different. So when we talk about getting Black women back to work, it is about making sure that not only do we ensure that Black women have pathways to jobs, but that those are jobs with dignity, that they provide a living wage, that they provide the ability to sustain and support life, and that they actually elevate the ability of a woman to take care of her family. For many of the Black women who are still in the workforce, we disproportionately represent a number of essential workers. The folks that were not getting PPE in the early days, the folks who still have yet to see the kind of hazard pay that they deserve, everyone from delivery drivers to grocery store checkout folks to nurses and doctors to teachers. Black women have continued to be on the front lines of this pandemic, and it is costing us years on our life, as well as the ability to support our families.
Now, people also say that crises can present moments of opportunities for resetting system. And I want to ask you, what do you think should be the top most urgent priorities for pursuing that reset? And who should be at the table?
I believe that an intersectional lens on justice is the approach that we have to take if we're going to get out of this. And that Black women, Indigenous women, Latinas, women of color who are suffering disproportionately from both the racial strife of this time and the sexist strife of this time should be at the center of this decision making. Look, this pandemic did not create inequality, it exposed it and it exacerbated it. So all of the inequalities that we're seeing in everything from medical outcomes to financial outcomes, all of that was in existence before COVID hit. So if we are going to take the lessons of this pandemic in the direction that we need, then we need to put the most affected folks, all the people that I just named, at the center of policy making, decision making, and setting rules and regulations from the local and state level all the way to the federal level. This is not just about getting folks back to work. It has to be about getting folks back to work in jobs that sustain them, that pay them a living wage, and that actually respect the dignity of the Black women who have lost them.
And are there urgent priorities? I mean, understanding that these are all sort of complex and interconnected, but are there urgent priorities or things that you think should be looked at first?
I believe there are multiple urgent priorities. I believe that childcare and elder care continues to be a deep priority for this country. When we are talking about a Marshall Plan for moms, this is precisely the kind of time that we need to see that happen. Fatima Goss-Graves, who's the head of the National Women's Law Center, speaks often about the care economy. And the fact is, the care economy is the foundation of everything else. When women do not have the space to provide child care, either because they're trying to work from home or they are essential workers, or when they don't have the resources to provide child and elder care because they've been put out of work by this pandemic and by industries that are not fair to Black women already, we see perpetual and generational effects that affects healthcare, that affects housing, that affects education, that affects a mom's ability to homeschool their child through the virtual lenses of this new landscape, as one example. So there are multiple priorities here. The care economy, I think, being one of the most important ones. The other one that I'll add is education, that Black women and women of color are disproportionately represented in the education field. And many of them will tell you that there are plenty of folks that never ever started teaching from home, and that there are plenty of educators who still don't have what they need to adapt to these times and serve students in the ways that they deserve. Now that folks are going back to school, we're seeing lots of plans being made without the input of students and teachers, the very people who will be subject to these ideas and new creations. So I think that those are two places that we can begin, and we can actually demonstrate how to create equitable models for everyone.
I want to pick up on both those, the students and the parents. So we also see in surveys that parents of color are more worried about the safety of sending their kids back to classrooms compared to white parents. Part of that obviously is most likely rooted in the experience of the pandemic, but also in how schools have and haven't worked for these families. And so it's not uncommon to hear parents say that virtual schooling actually for some has been a blessing, right? In terms of maybe their children felt unsafe or unheard in the classroom. How can those concerns be addressed? This is beyond the pandemic, obviously, but how can those concerns be addressed?
Yes, certainly beyond the pandemic, and they can be addressed by a user-first mentality. And I'm borrowing a business term here because it applies. If you really think about education like a long assembly line, there are folks who write textbooks and set curriculum. There are people who create schools and school governance models. There are folks who govern and regulate what happens in schools at one end of that assembly line. And at the other end of that assembly line, the end user are the teachers who have to deliver that content, and the students and parents who are there to receive it and nurture young people through their learning. So at the end of the day, far too many decisions are being made by the folks at the beginning of that assembly line instead of at the end of that assembly line. The solution, quite frankly, is to reverse that. But we often like to dismiss young people as not having the language to express what they need, but students know what they need. And I don't say this just from reading about it. I used to be a teacher myself, so I'm speaking clearly from experience. And in a third grade classroom with 8 and 9-year-olds, they could tell me what their needs were, what their hopes were, what worked for them in their learning, what didn't work for them in their learning. And their parents, guardians, and loved ones could tell me just the same. So that's precisely where the conversation should be starting with students, with parents, and with the educators that are there to deliver this content and nurture young people through these kind of unforeseen times. So the real solution is to put people first and to not trade in people's needs for the sake of efficiency. Yes, there is an urgent need to get all of this figured out now, but the same kind of lack of safety that you talk about are things that young people felt before this pandemic. A lack of safety around school discipline and the presence of school resource officers, a lack of feeling heard by their educators and the systems that are supposed to be designed with them in mind, but so often are not. The kind of bullying that we continue to see in schools, the kind of increase in suicide rates and suicide ideation because so many schools have school resource officers and not school counselors. So these are problems that persisted before the pandemic, and they will be, just like all of these other problems, exacerbated because of the pandemic. So we need to make sure that whatever solutions are set forward, that the people who will be subject to those new systems are the ones who co-design them.
I want to ask you real quick, as an educator and former elementary school teacher, what are young girls of color, what are some of the things that they face coming out of this pandemic? What are the big issues for them in the coming years?
Certainly, there's a challenge around learning loss, which is not to say that teachers haven't been working as hard as they possibly can. They have been. But certainly there is a question about making sure that all of our young people, young girls especially, are not left behind, and that they have the kind of enrichment support that they need to catch up with where they should be in life. But we also know that there are issues of safety that sometimes young girls encounter at home, sometimes at school, sometimes in their neighborhoods. We need to ensure that all young women have a safe space and a safe haven to be able to grow, to be able to not just survive, but actually thrive. on this International Women's Day, it is critical for us to remember that all young women deserve to thrive, and we are responsible to create those environments.
One last question for you. I was hoping you could share someone you've met or learned about during the pandemic that inspires you in your work.
Oh, gosh. Well, we met many years ago on the streets of Ferguson, but I talk all the time about my dear friend Kayla Reed, who is a brilliant and powerful organizer and executive director of an organization called Action St. Louis. And she has engaged in the kind of power building work that we need to see from people, even in the midst of this pandemic. So while they were registering voters, they were also helping people get COVID information and getting masks and hand sanitizer. She was helping bring people together to close the Workhouse, which is a medium security prison in St. Louis, where just like all of the other jails and prisons around the country, there's been a high incidence of COVID. So we see that kind of organizing happening on the ground, that people first mentality that folks like Kayla and so many other organizers around the country have figured out creative ways to maintain despite the challenges of this pandemic. So I'm always inspired by Kayla and everyone else who sees this as an opportunity for us to care for one another and to be better for the future.
Thank you so much, Brittany, for doing this with us today.
Thank you.
All right, and next we have a second video from our sponsor.
We are proud to celebrate our mentors, mentees, and those who have supported our Global Ambassadors program in partnership with Vital Voices. What started 10 years ago has led to Bank of America creating additional programs and new partnerships that have helped train, mentor, and fund more than 30,000 women who not only seek their own financial success, but who bring that success to bear on their families and communities around the world. Together, we will continue to expand our thinking and our efforts to help accelerate the impact of women everywhere.
Thank you to our sponsor, Bank of America, for making this event possible today. We hosted this event to look at the impact of COVID-19 on women of color and the experiences of Americans who are at the intersection of racial and gender divides. We heard from Brittany Packnett Cunningham and San Francisco Mayor London Breed about the physical and psychological toll of the pandemic, and more broadly about the challenges that Black, Brown, and Indigenous women face in the US today, as parents, as spouses, daughters, caregivers, and employees, and how they could be better supported. The bottom line is that the pandemic experience has varied immensely in the US, with many people fighting for their lives and livelihood. Why that matters is that as the country looks to exit the pandemic, the fractured collective experience and the memory of it could set a course for the country and for generations of women to come. Thank you all for joining today for another virtual conversation that has made everyone smarter faster. For more information or to sign up for Axios AM or our other newsletters, please visit axios.com/newsletters or on the Axios app. Thanks again for joining us today.